What are the causes of preterm labor? Vaginal or urinary tract infection, which could lead to chorioamniocentesis, premature rupture of the membranes, incompetent cervix, polyhydramnios, multiple pregnancy, uterine anomalies, faulty implantation of the placenta, substance abuse, short intervals between pregnancies, malnutrition, fetal death, extreme chronic stress, and maternal dehydration. Why are follow-up examinations and testing necessary for at least a year after a molar pregnancy? Because 20% of molar pregnancies progress into invasive cancer. Which maneuver would you use to check a baby's ability to engage? The Pollux maneuver, which is completed by placing your hand above the pubic bone with the mom in a semi-sit position. Have her sit up completely. If the head bulges into your hand instead of slipping into the pelvis, then it will have difficulty clearing into the inlet. What are the predisposing risk factors for gestational diabetes? PCOS, multiple unexplained pregnancy losses, stillborn baby, macrosomic baby, family history of the disease, marked obesity, and age over 35. Symptoms of GDM: increased thirst, urine output, recurrent chronic yeast infection, acetone breath, ketonuria, or persistent glucosuria. At what point during pregnancy would placenta previa be diagnosed? And what maternal complication is associated with placenta previa? Placenta previa cannot be determined until the last trimester of pregnancy, when the presenting part of the baby descends into the lower uterine segment. Placenta previa is associated with increased risk of postpartum hemorrhage due to the contractibility of the lower uterine segment. What are the signs of oligohydramnios, and how do you help correct oligohydramnios? Signs include that the fetus is tightly compacted in the uterus and fundal height is lagging. Corrected by adequate hydration. What are the potential effects of anemia on a pregnant woman? Fatigue and diminished vitality, decreased resistance to infection, preterm labor, prolonged labor with incoordinate contractions, clinical exhaustion, postpartum hemorrhage, and increased healing time. Adequate blank is necessary to build new blood cells, and blank must be available to maintain the integrity of the cell membrane. Blank is crucial for iron absorption. Adequate protein is necessary to build new red blood cells. Folic acid must be available to maintain the integrity of the cell membrane. Vitamin C is crucial for iron absorption. What would be a likely cause of bleeding after intercourse in the second or third trimester? Because the cervix is increased in vascularity during pregnancy and is quite often friable and easily abraded with friction. Also, the mother could have a vaginal infection and the mucosa will be irritable and more prone to bleeding during sex. Another cause would be ruptured cervical polyp. What is disseminated intravascular coagulation, DIC? It is a coagulation disorder in which is a result of retained products of conception after a missed abortion. DIC leads to catastrophic bleeding when the pregnancy is terminated. The incidence of DIC increases the longer that the fetus is retained after it has passed. What are some ways stress would manifest itself in a pregnant woman? And how would you treat stress? Stress tends to manifest in aches and pains at night, and insomnia may be medicated by increased vitamins B, C, trace minerals, protein, and calcium. What is the definition of spontaneous abortion? And what is the definition of fetal demise? Spontaneous abortion is characterized as a miscarriage occurring before 20 weeks. Fetal demise is characterized as a miscarriage occurring beyond 20 weeks gestation. What can help with common side effects of polyhydramnios? And what precaution would you want to take when caring for a woman with polyhydramnios? Adequate rest can help mediate side effects such as ankle edema and varicosities of legs and the vulva. If caring for a woman with polyhydramnios, check her cervix weekly for changes that might portend premature labor. What herbs would you suggest to a client who has low blood platelet count? Yellow dock tincture. It has been shown to raise blood platelet count by you should administer 12 to 15 drops in water per day. Also, an herbal elixir called Floridix, Iron Plus herbs. What is normal weight gain during pregnancy? And what is the normal amount of weight loss at birth? The average amount of weight gain during pregnancy is about 1 pound per week. Women lose an average of 15 pounds with the birth, or a few days thereafter. What is hyperreflexia, and how do you check for it? Hyperreflexia is a transitional sign indicating that preeclampsia has progressed to a more serious stage. You can check for hyperreflexia by checking for clonus. What minerals can a pregnant woman take in order to prevent hypertension in pregnancy? Calcium, magnesium, and potassium. 1500 to 2000 mg of calcium per day. What are the 3 types of placental abruption? What might cause placental abruption? Marginal abruption, concealed abruption, and complete abruption. With marginal abruption, separation at the edge of the placenta only. Concealed abruption, separation at the center of the placenta only. Complete abruption, total separation of the placenta. Causes include cord entanglement physical trauma, or hypertension, and often the cause is unknown.